Good afternoon, everyone. I want to take a few minutes and talk to you about a pretty difficult subject. We're going to actually talk about dealing with difficult parents. So many of you probably are like, are you serious? You're going to actually try to take that on? But I guess I might as well. So I wanted to talk to you about two different groups today. The first is that if you have, well, let me just say it in general. If you've been struggling with talking with your parents about their care needs, they're getting older and you're seeing their health deteriorating, but when you're talking to them, they are agitated, aggressive, confrontational with you, or possibly just always negative. I want to just share with you a couple things. I want to ask you though first, has the person always been like that? Do you remember that even since you were a child? And it's not new. That's an important factor to this. And the reason being is that as I've worked with the elderly, I've now been working with the elderly, started back in 1998. So it's been a long time. And what I notice is that I have families that will say to me something like, they've always been like that. And when I ask them if they feel like there might have been a diagnosis of some type of personality disorder or mental illness that was missed, they usually say yes. So unfortunately, that can be the case for some of you all, that you are trying to now communicate and always have been trying to communicate with someone that really hasn't been diagnosed, and there's been a mental illness underlying their behaviors or their interactions with you all for years. So that does make it difficult, and I'm not going to obviously lie to you that it doesn't. You all are living it, so you know it's difficult. The thing I want to share with you, though, is that no matter what age, we can try some techniques that may assist you in conversations to go better than they have been. So I've heard it said for many years now that if you have a person that you're talking with and they choose to speak as though they're a child, which means complaining, confrontational, that when they don't get their way, they're yelling or screaming, it doesn't mean that you have to kind of go to that same level and start talking like a child as well. You can maintain that adult-like behavior where you're not going to allow yourself to slip back into also arguing or yelling or going back and forth with the person, that you're going to maintain a level of being an adult like you would at work or anywhere else. So if that starts to begin, let's say it happens on the phone, and you're talking with your mom or dad and the negativity and the confrontation starts, you can simply say, "Mom, you know that I love you, but I've decided that us fighting like this is not good for either one of us. So while you're upset, I'm going to hang up, and when you're ready, please call me back so we can talk some more." And then just gently hang up the phone. Don't slam it down. Don't say that in a harsh tone. Say it as gently as you can, and then hang up the phone. If your loved one calls you right back, yelling at you, saying, "Don't hang up the phone on me," you say, "Mom or Dad, I've decided this isn't worth us fighting over. I love you, and when you're ready to call and talk, let's just talk. So I'm going to hang up now," and simply hang up. You do it until when they call, they're calm, and you just say, "I love you. I don't want to continue on like this, so I've decided that that's what I'm going to do, Mom or Dad. When this starts to happen, I'm just going to tell you I love you, and when you're ready to talk, let's talk." You have to maintain that adult behavior, because if you start yelling back or being aggressive back, now you've slipped into the same thing. So it's difficult, and it does rely on you making that decision and holding to it. So that's the first group. And the next group is, if this has not been a long-standing situation where they've always been negative, or they've always started getting in a confrontation with you when you start talking to them, there could be an underlying issue of dementia. Now, that word is thrown around a lot, so I want to be clear. It's not simply that someone is maybe going into depression, because depression can also cause what looks like dementia. And it's simply because there's so much going on in the person's mind that they're struggling with retaining information. So now that can be happening, and that can be impeding your conversations with your loved one. But if you're seeing that there's a lot of depression going on, help get them to a doctor. Help talk to them about that they don't seem to be themselves, and that you'd like to get them some help. And even a lot of us now at this age, I'm in my mid to late 40s. We don't mind if someone says to us that they're taking a depression medicine or something for anxiety. We understand it. It's no big deal. I'm glad that there's those medicines out there. But a lot of times for the elderly adult, they think of that as like you're saying I'm crazy. Make sure you're not sharing it that way. Make sure that you're just saying to them, Mom or Dad, you've had a lot going on, or ever since Mom passed, I see that you've been down, Dad, I'm worried about you. I'd like to see if we can just go and talk with your doctor and see if there's anything they can do. And just go to bring them to the regular physician. And most physicians nowadays are going to give their patient a small dose of an antidepressant to see if that will help. And there's so many out there that hopefully that will do the trick. But it can be that for some of you that know my story and have watched some of my other videos, my grandfather was such a godly gentleman. Really was very quiet. But when he started falling into dementia, into Alzheimer's, it was more of a vascular dementia, to be honest with you, his personality changed. And he became more agitated, definitely agitated quickly. And when he did that, we didn't know what to do back then. But now there's so much more information and education about dementia. So if you're seeing that the person is struggling with their memory, struggling to recall certain things, and that them being difficult is a newer thing, I'm going to ask that you sit back for a minute right now and contemplate, might it be how you're approaching them on certain things? I know it's hard to do that, okay? But quite often what I've seen, and the statement I've made as I've worked with the elderly that have dementia or Alzheimer's, is I've even told my staff, if an argument breaks out with a staff person and someone with dementia, or a family member of that resident with dementia, that quite often, unfortunately, it's just the way we approach them. It wasn't our intent. It's not that I'm saying anyone intentionally is trying to do that. It's just we are trying to keep them in our world, in that normal frame of mind that we've always seen them in. So we're trying to reorient them quite often. So we'll say, well, Dad, don't you remember when? Or, of course you remember, Dad, remember that? And we're asking these questions that truly they don't remember it. And the hard part for them, remember, anything with dementia, like an Alzheimer's disease or vascular dementia or some of the others, it's really brain failure. So parts of their brain are dying. And if you've ever seen some of the pictures of a person that has passed with Alzheimer's, there's a significant difference in the brain size of someone healthy without dementia, without Alzheimer's, and someone with that has passed away. And doing an autopsy, it shows that the brain has deteriorated. So what we need to do as the adult, as the one that does not have memory impairment, is not going through that, we need to change how we're communicating. We need to put our relationship with our loved one above being right. So try to keep those words of, do you remember? Or, of course you remember. Try not to say those. And I know it's going to take a while to get used to not saying that, but replace it with stories that are just talking about it. Talking about, tell me about, your mom, or tell me about grandma, and let them just share. And you'll find that when you can reminisce with them about things and not try to bring them back to, well, Dad, yeah, it's 2019, it's not 2012. When we do those types of things, it's unfortunately initiating an argument that neither one of us will win, because our loved one doesn't want to think that it's 2012. Unfortunately, their brain is not allowing them to remember it's 2019. So let me give you a for instance how this can happen. I have 4 children, and the way Alzheimer's or any type of dementia typically works, most of them, is that we're going to start forgetting the most recent memories first. So that's why short-term memory goes, and it's a problem for folks with memory impairment, is their short-term memory is bad, but they can remember stories from when they were a kid, like it was yesterday. But let's say I have advanced Alzheimer's, and I'm talking to you, and you ask me, or someone asks me how many kids I have, and I say 3. Let's say my wife were to say to me, well, honey, we have 4 kids. Imagine how I would feel. I would be thinking, first of all, oh my gosh, I'm worried about my memory if it's my wife saying that. But the other thing I could be thinking is, what's wrong with you? Are you crazy? We only have 3 kids. We don't have 4. Or lastly, it could be, especially if it's someone that we don't know. Let's say a staff person in a community, and I say I have 3 kids, and they try to tell me I have 4. Inside, I'm going to be thinking, how dare you tell me how many kids I have? Of course I know how many kids I have. I have 3 kids. It's not my intent to forget my 4th. It would break my heart to know I forgot my 4th child. It almost makes me want to cry thinking about that right now. But that's the reality of dementia. And for us to try to reorient that person to that they have 4 kids is just asking for an argument. And it's one that neither one of us are going to win. So when someone does that, when they're wrong, just say, well, aren't they the best kids ever? Just share something. Don't try to correct them. So I hope this has been helpful. I know talking with a parent that is negative or is confrontational is very difficult, and I'm so sorry that you're going through that. I pray that most of you are not going through that. And I pray that most of you, and I pray that all of you, will never have to go through it, if that's possible. But I hope these tips have been helpful. Please reach out to me when I could be of help to you. My number is 615-591-4388. And lastly, I just want to wish you all a happy Thanksgiving. We're right upon Thanksgiving time. I pray that you're going to be able to get together with your family and have a good family time together, and that you enjoy that. Please utilize these tips. If anything comes up while you're together as a family, try to remember these little ideas I've given you. And lastly, please make comments below. Tell me what you'd like me to talk about in a video in the future, and I'll try to make a video for that. If you're seeing this on YouTube, please like this video and hit the subscribe button next to it. I always say that wrong. Subscribe button next to it. And along with that, the bell to the right. Please hit that bell as well, so that if you haven't already, so that you'll be getting my videos as they come out, that you'll be alerted to them. If you're seeing this on Facebook, please like the video and share it with others. I'd greatly appreciate that. I just want to be helpful to folks out there that have questions of how to interact with their loved ones through these difficult situations. But I pray you have a wonderful Thanksgiving, and I look forward to our next video. Thank you so much. Take care now.